The drug called hydroxychloroquine is being tested as a potential treatment for COVID-19, but those tests are in the early stages. President Trump said he's been taking it, and that has renewed some interest in it. We interviewed a local cardiologist, Dr. Sholi Daoud, about it, what it does, and if it is ready to be prescribed for COVID-19.
It has been mostly used for patients or for people who go and visit Africa, as they take a weekly dose to prevent malaria. So as you've heard recently in the news, because of the COVID-19, there was some evidence all stemmed from a small study in France, where that studied in combination with azithromycin, which is an other antibiotic, and has shown initially some very hopeful data showing some benefit in the beginning, in a very small, uncontrolled study that did not include a control group. And that's when the media actually took off from there, and people started, having a lot of discussions. So essentially, it's an antimicrobial, essentially for malaria, but also it's been used for a long time also for treat rheumatoid arthritis and lupus. And it does have multiple side effects, but at the same time, it has been effective in treating those conditions.
It would be a long time then before this could be used as a viable option, is what you're saying, because all those other things need to be,
Yes, actually, it's not even close to being used for treatment of COVID at all. The only medication with much more efficacy is remdesivir, as you know. That's a little bit for more sicker patients. Whereas as of right now, we don't have enough data. All the clinical trials or the studies coming out of Brazil and France actually have shown negative data. There are increased incidence of deaths in those patients. So at this point, it should not even be promoted to be has anything to do with COVID. We don't have any clinical evidence. So in cardiology, as in many areas of medicine, we like to go by evidence-based medicine. We like to do well-conducted clinical trials, compare the outcomes, efficacy, as well as side effects and adverse events. Just because the medication might be beneficial in certain aspects, we can also we have to make sure that what's the downside? What's the benefit if it helps 5 people and kills 11, for example? So that's not an effective medication. We have to look at the whole data in its entirety.
Hydroxychloroquine is able to be prescribed in Nevada for COVID-19 under very strict conditions. The patient must be confirmed to have had it, and it must be prescribed by a doctor under their supervision.